Yeah. Okay. Let's start. See, last I introduced a very interesting remedy. A part of which is what we had covered in the last class. Okay. So the remaining part of the remedy we will try to finish today. Okay. So the remedy we spoke was Anacardium. Very good. And what was that part we tried to cover in Anacardium? Mind. Very good. So we spoke about the mind. Okay. And mind again, I tried to explain Anacardium in a new method, like what Dr. Kent had advised. Generally we do this in the analysis. When we analyze the case, we do this. So under what techniques we try to understand the mind? Will, intellect, emotions, as well as models. Okay. So what is it that you have under will in Anacardium? Weak will. Okay. Then they also have issues with confidence, inferiority complex. Okay. And people who are having confusion, meaning what to do, what not to do. Irresolute, and people with two wills. Dual-minded people. And what did Dr. Ken tell in this material medical? One shoulder you have angel and the other shoulder you have the devil. So one says do good and the other one says no, you continue doing bad. Okay. So that was about the will part. And even the intellect we saw. Intellect is not all that great in Anacardium. And what we also saw was they keep laughing at serious things. Fine. So what we also concluded was the intellect is poor in Anacardium. And emotion was one area which was blown out of proportion. And what we saw was there are the kind of people who are very, very cruel. And they also have a lot of anger issues. Very violent anger. Anger going to the extent of rage. Intense anger. And they will not know what they are doing in anger. And we also saw that they are very, very violent. Very, very violent. They have issues with memory. That very cruel, very inhuman. And one more thing which was included under morals was the tendency to curse. Tendency to swear and tendency to curse. That was also very prominent in Anacardium. Okay. So any quick questions in Anacardium mind? Anything you want me to repeat? You had a colorful PPT through which I tried to explain Anacardium. See, assuming Anacardium mind is clear, I'll just try to complete the remaining part of Anacardium. But what predominantly we use in clinic is, complaints related to mind. But then there are also few bodily symptoms for which Anacardium gets indicated. So hopefully next 40 minutes we'll try to cover the bodily part of Anacardium. Okay, the remaining part of Anacardium. Now, what is it that we are going to do? What is it we are going to do next 40 minutes is, we'll be focusing on 4 very important areas. Okay? We'll be focusing on 4 important areas. One is the sphere of action of Anacardium. We'll look at this. And the second area we'll be looking at is the ailments, or what we call it as the causative factors of Anacardium. And the third area will be a very important area, the PQRS. We will be using the knowledge of all the 3 and we will be looking at few important particular symptoms. Okay? So it is all connected. If you understand sphere of action, if you understand the ailments from, and if you understand the characteristic symptoms, this part becomes very easy. Okay? So that's why I am using the word, it is interlinked. So please be focused, please concentrate. If you don't focus on these 3 areas, and when you start suddenly focusing on the particular symptoms, you will be in a difficult spot. Okay? So Anacardium, source books, they don't give much of information, but whatever I have studied, and what is it that you see where anacardium predominant acts is the mind, which we have already explored. Okay, and apart from mind, we also see anacardium acting on the nervous system. Okay, and the third area the source books mention is muscles, and the last area is the joints. Okay, so at least these two things, musculoskeletal system. Better remedies. All your first year remedies. Restox, arnica, okay, and symphytum, okay. See again, anacardium is a remedy for injuries of tendons. Okay. And another area where you see anacardium predominantly acting will be the gastrointestinal tract. GIT, gastrointestinal tract. Okay. Now, before I talk more about the ailment storm, any other remedies, I have been trying to tell you, second year class, it's between 2 to 3. So, this is the time as per your anatomy. Stomach needs lot of rest. Meaning, they say the inferior gastric artery, maximum blood goes, the blood supply happens to the inferior gastric artery because it has to engage in the process of digestion. So what are we trying to do is, we are trying to go against the anatomy. We are not allowing blood supply happening there. We also want some amount of blood to go to your brain and keep you active. Okay? Don't give me this lame reason, sir. 70%. So let us relax. But what I want you to understand is other remedies acting on nerves, muscles, and of course hypericum, causticum, good. Naxomica, agaricus, calibro, gelsium, very good, gelsium. Agaricus, allium cepa, good. Who was that allium cepa? Okay, so what made you think of allium cepa? Okay, fine, good. Okay. So you are proving right. Okay. So I just wanted to confirm, many times we don't think of allium cepa. Because we think of allium cepa when we talk of nose. Coryza. But one girl, brave girl, has told allium cepa. And then luckily one more girl defends her, telling allium cepa is mainly thought of in neuralgia. Agreed, very good, neuralgia. Right? Okay, any other remedies? Colocynth. Now what do you have in colocynth? What do you have in macphos? So they are mainly again indicated for neuralgia. See, recently I had a case, of a man with pain over this particular part, and he had gone to the best dentist. Dentist has done root canal, they have done a lot of things, and unfortunately the pain is not subsiding. Super specialist consulted, pain not getting better. Okay, so ultimately, what I assume could have been the problem is more of trigeminal neuralgia. Luckily, that diagnosis got confirmed, and a simple remedy you can think of, for trigeminal neuralgia, especially of the left thigh, is spigelia. So this gentleman was given spigelia, and he is doing much better. He was hopping from one doctor to another doctor, from different dentist. He landed up with the neurologist. Okay. And in between he also had a stopover in my clinic. So I told him, sir, for me it looks more like trigeminal neuralgia. Sir, but I have an appointment with the neurologist tomorrow. I said, please go ahead. Don't hesitate, because we need to diagnose what the problem is and we need to treat accordingly. So fortunately the diagnosis came to be the same. So trigeminal neuralgia was the problem. So nerves, when you have more of neuralgias, you can think of colocynth, you can think of macphos, And of course, Spizia, beautiful remedy. I think it's there in the third year syllabus. But out of interest, you can just have a look at Spizia. Naxvomica, causticum, ignitia, natrum, lot of remedies. Now we look at the ailments from, again ailments from, you can compare lot of remedies. If you just look at the image taken from Google, the first ailment you have in Anacardium is ailments which mainly comes up from mental exertion, mental strain. We saw a lot of mental symptoms in Anacardium. Okay, ailments coming from mental strain, mental exertion. Quickly, other remedies. Mental exertion. Okay, coffee. Coffee is more of mental excitement, not exertion. No, before you start shooting other remedies, get the clarity here. One of your friends immediately said, out of excitement, he said, coffee. Now what is that you have in coffee is mental excitement, not mental exertion. What is mental exertion? When you feel strained. Coffee does not feel strained. Coffee feels excited. When do you drink coffee? When you feel strained. You get my point? So excitement brings on problems in coffee. So mental exertion, better remedies. Lycopodium. Okay, lycopodium. Ruta, you agree with Ruta? See, Ruta will have more of physical exertion, more so eye strain. Okay, arsenic, lycopodium, naxvomica, simple remedy, naxvomica. Heard of caliphos, gelsemium? These are few remedies which can have ailments from mental exertion. So, moving forward, we also have ailments which mainly comes during exams. Now, why is this ailment in Anacardium? Because Anacardium is a beautiful remedy for examination fun. What we call it as fear of exams. Fear of exams. In the last class, we have differentiated many remedies. Starting with Ethusa, starting with lycopodium, Felicia, gelsemium, argentum nitricum. Yes, good, argentum nitricum. Exams. Now, I also told you in class, argentum. For example, you have been given a presentation, and assuming you are argentum, time is 2. 2 is when you should start the presentation. 2 o'clock, the speaker is not there. Okay, and you are waiting for the speaker. But you know where the speaker will be? He will be the washroom. He will be the washroom, because there will be a lot of anticipation. How my presentation will go, what will happen, etc., etc. And this will bring a diarrhea. Now what brings on diarrhea in argentum? What brings on diarrhea in argentum? Anticipation. What Dr. Kent says, before going to a church, before an engagement, they have to rush to the loo. Now this is what happens. 2 o'clock is the presentation, and if it is argentum, don't expect he will be here at 2. If you are very keen to see him at 2, you should stand outside the washroom. You will find a speaker there. Okay. So argentum is also a very beautiful remedy, and similarly, you have ailments which mainly comes from fear. Fear. Again, a lot of remedies. Starting with aquanet, till the recent remedy we did, where the fear remains for a long period. I told you mother had fright during her pregnancy, and the child suffers the effects, and that is opium. Beautiful, opium. Okay? Gelsemium, lot of remedies, ailments from fright, ailments from mortification. What is this? Ailments from mortification. When you have a combination of embarrassment and a combination of shame, you feel ashamed of something or you are embarrassed of something, this combination is what we call it as mortification. Humiliation, insult, embarrassment, you feel ashamed. Fine? So, mortification. Okay? We spoke of a remedy recently. Ailments from shame. Who's that? Very good. George Abona. Opium or loudspeakers? एटलीस्ट जब आप एक रेमेडी बोल रहे हो ना, वो रेमेडी के हिसाब से बोलना। शायद आप if you want to tell staphysagra, you can tell little, in a very mild tone. You know why? Staphysagra is worried about dignity. For them, dignity is very important. अगर आप जोर से बोलेंगे और वो रेमेडी गलत है, तो staphysagra will feel very bad. But what will opium think? Opium मेरा आवाज ही loud है. Okay. Fine. So when you are at least telling opium, make sure you tell with a lot of energy. So opium, absolutely right. And staphysagra, good. But staphysagra is more of dignity. Okay. Opium might feel ashamed. Ailments from shame. Okay. Lycopodium, ailments from mortification. We also have remedies like colocynth, colchicum, bryonia, yes, it's there, bryonia. Okay, netromere, ignitia, whatever you are talking about. These are remedies you should think of when you think of ailments from mortification. Ailments from disappointment. Ailments from disappointment. Again, a remedy which stands up, the number one position is ignition. Absolutely right. Ailments from disappointment. Ignition. Okay. Netromere. See, whenever you tell ignitia, please tag in netromere. But you should be a little confident when you are answering. Okay. So, ailments from disappointment, and a beautiful image from Google. Ailments from sedentary habits. I have explained you when I did aloes. Okay. When I have done Naxwamika, I have explained what exactly I mean by sedentary habits. Now, what do you understand by sedentary habits? Where you are sitting for a long period. The movement is very minimal. Everything is happening here. See, for example, work. See how beautifully he has taken care so that this laptop also will have a very nice rest. And what has contributed to this beautiful thing is all this thing. With due respect to the image. But one image tells you so much. Laptops stand up is very right? You are getting my point? So beautifully I have structured my body. कि सब कुछ एक ही पीस में मिल जाएगा. You are getting it? So ailments from sedentary habits. Better remedies? Naxwamika, aloes, bryonia, calcarea, okay, lycopodium, sulfur, king of laziness, height of laziness. Sulfur, everything you'll be showing sitting there. पूरा दुनिया घुमा देगा. बस मैं कहाँ हूँ, आप इधर ही हो. But you are taken to all the planets, everything, and you are fortunate if they bring you back. Okay, so they are sulfurs, fine. Great, I mean, whenever you see some lazy person, no? See, laziness is still fine. You are lazy, but you talk all, what is it, intelligent talks. How you should walk, how you should keep yourself fit, how being fit helps you in becoming healthy. Everything is sitting, eating chips, and a lot of other things, and he will be giving you gyan. He will be giving you knowledge. So sulfur is a person who preaches. A preacher who never follows. What is it? A preacher who never follows. Very good for preaching. ऊपर बैठेंगे, ज्ञान देते रहेंगे. Baba. And we are all sitting and listening. But this gentleman will never follow what he preaches. मैं सिर्फ बोलने के लिए हूँ. I am here only to preach. Done? So, sedentary habits and bad effects of drugs and alcohol. Anacardium. And bad effects of suppressment. Celicia. Accolade. You also have it in colchicum. Okay. And another very important ailment I have listed is sexual excess. Ailments from checked perspiration. Checked perspiration means suppressed perspiration. Ailments from sexual excess. Better remedies? Okay, carbomage, agaricus, lycopodium. Maximum amica. See, when you have all these things now, meaning alcohol, sedentary habits, sexual excess, one remedy that should come to your mind is maximum amica. Similarly, stereosacria. We have a guy who has done his PhD in stereosacria. But I am happy you got it right. Absolutely. Agnes Baer. So not only in stereosacria, I have also done my PhD in Agnes. Agnes Castor. Good. Okay, chalo. Your friend is talking about Agnes. Now, is Agnes done?
Yes, sir.
Yes, done. No. For people who have sat in the class, who have attended, it is done. For people who have sat in the class, not attended, it is not done. Come over, we class, same class. Come on, chalo, wait, what is important? No, let's not have a discussion, done or not. But Agnes is also a beautiful remedy for bad effects of sexual excess. Impotency which comes because of sexual excess. क्या टाइगर जिंदा था? There was a time when I was a tiger. There was a time, but now. So I am not telling tiger जिंदा है. What I am trying to tell you, tiger जिंदा था. एक ज़माने में. Right? So that is Agnes. We have people coming to clinic, sir. This thing was very good way back. Now hardly anything. Okay. So we look at it a little later. Sexual excess and two small things we have covered. We'll get back to the class. Two small things we have covered. One is sphere of action, and focus was on the GA, mind, and of course the connective tissue. And I told you a specific affinity in anacardium is for tendons. Okay. And then ligaments, and of course we spoke of the ailments now. And now we are looking at the characteristic symptoms. Okay. Characteristic symptoms. Now what is characteristic? What is unique in anacardium? There are so many common symptoms and there are few characteristic symptoms. So we look at the characteristic symptom. Now if you read any good book, Dr. Allen's, Dr. Kent's, Dr. Borik's, E.F. Harrington, Dr. Clark, beautiful books. So what you see here is sensation of plug. What is it? Sensation of a plug. Now plug means a piece of wood, cork or other material used to stop up holes or gaps. So sensation as if something heavy, something hard. A plug kind of a sensation a patient feels. And this plug kind of a sensation in anacardium can be either felt in the eyes, head, rectum or any other part. Sensation of plug, very important. Okay. Not only the sensation of plug, you can also have a sensation of a band. Sensation of a band. So sensation of plug or sensation of band, and very important for you, in anacardium, majority of the things in anacardium, please remember, majority of the symptoms in anacardium, they are better by eating. Eating amelioration is a general modality in anacardium. Headache, earache, this pain, that pressure, anything you know, what are you better with? I am better by eating. This anacardium. Okay. So better by eating and better by slow movement. Better by slow movement. How is it different from pulsatilla? You also have this situation in pulsatilla. Pulsatilla, slow movement, especially in open air. Dr. Kent uses the word strolling. S-T-R-O-L-L-I-N-G, strolling. Means slow walking. Slow walking in open air. They feel better. Slow walking in open air, they feel better. Moving about slowly ameliorates. One more remedy? Huh? Okay, good. I'm happy somebody said Restox. See, how is it in Restox? Initial movement aggravation followed by amelioration. One more remedy you should also think of here is ferrum. Is ferrum done? No, not all. All of you agree it's not done? Oh, good. Okay. So ferrum, slow movement aggravates. See, ferrum is a beautiful remedy for anemia. Okay. So they, because of less hemoglobin, they cannot walk fast. They feel breathless. Slow movement in ferrum ameliorates. Done? Okay? So we are focusing on the characteristic symptoms of anacardium. And we started with plug-like sensation. We started with band-like sensation. Two important ameliorations we have taken up. One is eating, and second thing is slow movement. Continuing with the characteristic symptoms, you see people who love sweets, desire sweets, desire salt, both sweet and salt. Okay? And what is it that they don't like? People who don't like peas. Kannadadalli batane antevalla, peas. They don't like peas. And people who also have an aversion to beans. Beans. Peas and beans are two very important things. This particular remedy has an aversion to. Okay. See, all these things are important. You know, when we talk of particulars, you can start contributing and it will become very easy. Very easy. Okay. And what is this you see here? Watts. Very good. Watts. Many times, you know, a well-indicated remedy can prevent what's going to the dermatologist. Generally, they cauterize and they do treatment according to their, method with due respect. But what I'm trying to tell you is, if you treat correctly, there will be no need for a dermatological intervention. It goes smooth, without any scar, without any marks. That, so what remedies come to mind? Looking at this picture. See, if it has to be Dalkamara, then I have to flip it. I would have to put a picture like this. Please remember. Somebody was done Dalkamara, they would have told you. Dalkamara has warts over the dorsum. Good, I am happy. Dorsum of the hand. Either. So this is exactly opposite. Palms. And a remedy you should remember is netramure. See, tuja anywhere. See, tuja is anywhere. And tuja has its own character. But we are focusing on palms. So, remedy is netramure. What's over palms? Okay. So, these are the characteristic symptoms. What are the characteristic symptoms? Very few. We started with the sensation of plug, sensation of band, and then we spoke of eating and slow walking, amelioration. Then we also spoke of desires, aversions, good. And then last thing we spoke here was warts. Okay, chalo, good, warts. Then we look at few particular symptoms. I am typically not going from head to toe. Okay, I am taking up what is important. And what is it that is important in Anancardium is, first thing is head. And GA is very, very important. And we also have few symptoms related to the skin. And rest, we can look at it as an assignment. Okay. So we'll quickly look at the head symptoms. Now what do you expect in Anacardium under head? Main headache, good. Can you think of the causative factors what can bring on headache in Anacardium? Mental exertion, very good. Exams, mortification, alcohol, okay, fear, fright, are possible things which can bring on headache in Anacardium. Okay, and good, sedentary habits. The type of headache, as a second year student, you can have something called as gastric headaches, what we call it as migraine. Okay, and second very important headache, because you are talking of mental stress, you are also talking of exams as a causative factor. The second very important headache you can also think of is, rightly said by your friend, nervous headaches. Nervous headaches. Gastric and nervous headaches. What is it? Gastric and nervous headaches in people with sedentary habits. In people with sedentary habits. Okay. So this is important. This is important. Gastric and nervous headaches in people with sedentary habits. First thing. Now, We are trying to apply what we had read. I gave you the cause. Now what is that sensation they have? Which I have already given under characteristic symptom. The sensation is they can either have a sensation of band around the head, first point, or more important what we saw was sensation of a plug. Okay. So either this part I feel some kind of heaviness. If you ask the patient more, what is it? Sir, I feel there is something hard here. Okay, there is something hard here. Now this is what you have to remember. Sensation of plug which can be expressed by the patient as hardness, heavy feeling in a particular area of a piece of wood, metal, etc. in a particular area. So this is what Professor Vijaykrishna he writes in his Materia Medica Viva. Okay. Now this is one part, and what aggravates the headaches? What aggravates? Mental exertion, coughing, bending head backwards, all these things aggravates. Movement, motion, all these things aggravate. Eating, exercising, hard pressure, these things ameliorate. So headache better and headache aggravated. We are talking about modalities. And a remedy for gastric headache. So what you also see is headache associated with nausea. Headache associated with nausea. Nausea. Okay? Fine? So this is related to the head. We will focus on an area which many times in clinic we indicate anacardium. And that area is the gastric area. So any wild guess, where do you see anacardium acting? Where do you see anacardium acting? So it has a special affinity for the GIT, especially the stomach. So acting on the gastric mucosa, right? Acting on the stomach, what you see is it causes weak digestion, indigestion, weak digestion. There can be gastralgia, there can be pain, gastralgia. So what happens to this gastralgia? When do you think the gastralgia is better in anacardium? Gastralgia better by eating. Okay. So gastralgia, gastritis, distension, sour belching, okay, nausea, that sour eructation, pain, discomfort, distension, okay, all these things are better by eating. One. And appetite, there is something very peculiar in anacardium. Loss of appetite alternating with excessive hunger. So should I repeat this? Loss of appetite alternating with excess hunger. Okay. Now this time, what I have mentioned, 11 a.m. Does this remind you of any other remedy? Very good. I am very happy. You thought of sulfur. What happens in sulfur? Hunger. All-round sensation at 11 a.m. Okay. If I am a sulfur teacher, like Argentum, before seminar, your friend will be in the washroom. If I am a sulfur teacher, my class is at 11. I might excuse myself telling, I will be little late. And every day 11 o'clock class will happen at 11:15, 11:30. Why? Because your sulfur teacher might feel organ sensation or you might feel hungry at 11. So 11 a.m. organ sensation. Similar thing you also have in anacardium. Organ sensation comes on only when the stomach is empty and it is better by eating. And this is what you see here. Organ sensation better by eating. Okay. So this is we have a little more under GI. Hope you have got this. Mainly gastritis, gastric weakness, pain, discomfort, distension. What else can come under GIT? What are the other broad headings? under which we can think of the headings. You said something. Desires and aversions. See, we are still talking about stomach. Don't jump to constipation. Right? Okay. So desires, aversion, you can focus. And what are the desires in Anacardium? Sweets and salt. A better remedy that has desires for sweets and salt. Okay, Dietary has sweets, salt. Okay, Silesia, somebody was talking of sulfur, lycopodium. Another remedy you should remember is, again, I don't know whether you want it or not, it is coming again, and that remedy is Argentum metricum. Argentum metricum loves sweets, but again, after eating sweets, you will see them in the washroom. So, there are two types of diarrhea in Argentum. One diarrhea is a gastric diarrhea, the cause for which is sweets. They love sweets, but they cannot tolerate sweets. Argentum. Second diarrhea is out of anticipation. I have some presentation, I have to meet somebody. Argentum nitricum's boyfriend, if she has told him to come at 11 to give him the verdict, if she is going to like him or not, or if she wants to take it to the next level, whatever. So if she gives him a time, and that time he will be worried, will she agree, will she accept, will she not accept, and he will be busy in the washroom. Lot of sound, and he will have his own set of problems. So desires and aversions should come under J, should come under stomach. And all the gastric complaints, as you know, as a physiology student, you know, in Anacardium is mainly because of mental exertion. The more they exert themselves, they land up with gastritis. Gastric affection after bad effects of mental exertion. As a second year student, I don't know how much of systemic pathology is over. Good. It will be done, don't worry. You are playing very safe. And I am happy you are all united in the crime. And majority of you are told to be on a safer side, so just started. Sorry, I cracked my ears. So, not yet started. That's the best answer. So, no, I mean, when whenever it is getting started, please remember one condition. Okay, your teacher will talk, and that condition is duodenal ulcer. Okay, there is something called as gastric ulcer and duodenal ulcer. Both together we call it as peptic ulcer. Okay. So what you will have to understand is, in duodenal ulcer, they feel better by eating. And in Anacardium you saw the gastric things, or many of the gastric complaints are better by eating. So directly or indirectly, Anacardium can be a beautiful remedy for duodenal ulcer. Because you have the symptom of ulcer, better by eating, which is very evident in Anacardium. Okay. Without disappointing the person who told constipation, we will come to this part. Okay. Now you know this is constipation, and I know you can give me a list of remedies for constipation. Okay. Starting with Brevia, Colchicum, Aloe, Silesia, Cuprum, Opium, Calcareca. Very good. Please remember the remedy you have contributed, because you have to answer. Okay, so like for example, I am happy one of my friends was talking of Calcareca. And you know the beauty in Calcareca, 4 days they don't pass stools, they have absolutely no issues. They can eat the same amount of food, fine, they can sleep, they can have no issues. The day the Calcareca passes stools, he feels कुछ अजीब लग रहा है, कुछ अजीब लग रहा है. 4 दिन नहीं हुआ, नहीं वो तो ठीक था, लेकिन जब हुआ ना उसके बाद अजीब लग रहा है डॉक्टर साहब. That is Calcareca. And what is the symptom you have in Calcareca? Better than constipated. What is the symptom? Better than constipated. Good. Calcareca, and you know the normal remedies, Brevia. as it burned, lot of staining. Fine? Okay. And what did I tell you in Brainia? What Dr. Borik says? No urge, no Brainia. Beautiful. No urge, no Brainia. Correct? Yes or no? See, at least Brainia will not have ineffectual urge. Naxomica will have ineffectual urge. So if a patient feels like going often, no, that is not Brainia. Okay. Brainia will have obstinate constipation. Huh? So too much of urge is contraindicatory to Brainia. Is contraindicatory to Brainia. So alumina, how is it in alumina? Huh? Dry, soft. Now why is it soft? Or can you include one more word in alumina? Constipation for soft stools. The patient will be disappointed. Sir, so much are straight. You know what, sir? Stools are very soft. So what was his expectation? I've strayed so much, it should be hard. But it is very soft. Alumina. There is paresis. Weakness of the muscles. Because of which they are straining for soft stools. Alumina. Okay. And you also have many other remedies. Asculus, Silicea, causticum. What is the beauty in causticum?
Standing.
Yeah, correct.
Gravity.
Can pass stools only while standing. And if you imagine, you know it is not a normal phenomenon. Right? Can pass stools only while standing. 1 second, close your eyes, imagine. And you know, you'll be surprised, sir. How is this possible? But the patient says, and causticum, probably very few remedies or single remedy, causticum, constipation, or can pass stools only while standing, causticum. Okay. Now the beauty in this particular remedy, fine. Now what happens here is, like Naxomica, what was important for us in Naxomica? Ineffectuality. So Naxomica goes, passes little and he comes. Again he feels like going. In Anacardium, there is something very interesting and important. They get an urge, they go to the washroom, no stools, they come back.
Scam.
Your friend says scam. Fine. So in Naxomica, at least there is an urge to pass and little quantity goes. That is the difference between Naxomica and Anacardium. Both will have ineffectual urge, but desire passes away without evacuation. This is important. Rectum seems powerless, paralyzed, with sensation as if plugged up. The sensation of plug strongly comes up here in the rectum. Sensation of plug strongly comes up. Okay? So this is very, very important. Rectum seems powerless, paralyzed, with sensation as if plugged. Okay, Anacardium. And skin we have warts and few eruptions, vesicular, pustular, dry eruptions, and the eruptions keep itching a lot. Okay. So a 5-mark question that can come up in your exams. One is mind. If you are not lucky, then you can have a question on the J. Sure short question on the J for 5 marks. So can I go to the next slide? Okay. Done? Okay. So the next thing is we are talking about the skin, the last slide. I told you about the warts and eczema, itching, eruptions, pustular, vesicular, dry, itching aggravation night. Aggravation night. So this is to do with the skin. And the modalities, I gave you a clue way back. Majority of the ailments can be aggravating factors. Okay? Like for example, checked eruptions, morning, evening motion, anger, mental exertion, before exams, alcohol, all this can be aggravating factors. Now what ameliorates? Eating, slow movement and rubbing, especially headache. Headache better by rubbing. Okay. So eating, rubbing, moving around slowly. Rubbing should remind you of another animal. Very good, podophyllum. What happens in podophyllum? Yes, correct. Liver complaints, good. Liver complaints better by rubbing. Crotantic क्या होता है? See, crotantic, they will have eruptions, bad eruptions, and they are very raw, so they can't scratch. Intelligent people, they rub. Okay, fine. So eruptions are very raw, and because it is raw, they just rub. They don't scratch. Crotantic. Podophyllum, right hypochondrial region, pain better by rubbing. So before I close, we will quickly understand if whatever I have told was clear. At the end of the session, the learner is able to recall the sphere of action. So we spoke about GI, the connective tissue, nervous system, and of course the mind. The second area we spoke was ailments from quite a few, from 9 to 10, sexual excess, mental exertion, exam, fear, fright, mortification, sedentary lifestyle, alcohol, drugs, and disappointment, check perspiration. Good, very good, check perspiration. Characteristic symptoms? Sensation of blood or sensation of hand. Eating, walking. Desires? Sweet and aversion? Peace. What was the specialty of constipation in Anacardium? There is ineffectual urge, but when he goes to pass, there is no evacuation. And what's predominantly seen on? Okay. And with all this, you have the background of mind, which was very, very prominent in Anacardium. See, basically very cruel people. Very cruel. Inhuman. That is the word. Inhuman. Okay, being a human being, we are supposed to behave a particular way. Animalistic behavior. What is it? Behavior like an animal. Screaming, biting, hurting. Right? Very hard-hearted. Many of these kind of things you will have to remember Anacardium. But the tragedy is nobody will come with a tag telling, I am cruel, I am hard-hearted. Nobody will come with a t-shirt with written all this. This is something which you have to realize. Recently, I forgot to mention about another case. We have a special child, meaning she is a case of cerebral palsy. Okay, she walks with a lot of difficulty and all. So her father was beside, and when he was narrating, for some reason in front of me he slapped her. Some small thing she did. Is it normal or abnormal? See, father slapping can still, I mean, naturally it's his child, but you as a homeopath, you are understanding. See, special child, and I was the witness, there was nothing grave mistake that she did. Something, I don't even remember what the incident was, but it was very silly. But forget about the situation. He was in a clinic in front of me, he gave her a tight slap, which was not called for. Okay. So here again you can take cruel. Not necessarily, see, please don't conclude Anacardium. Because you are in a stage where you know only Anacardium. But as you grow with homeopathic remedies, you will realize there are many more remedies which are cruel. Okay. Like you have hepa, you have medorinum, you have nitric acid, you have got abrotinum. Beautiful remedies. Fine. So, and he came for treatment for his, some disease, I have not named the disease, he came for treatment. The first thing I remembered was inhuman. My entry first point was very cruel father. I cross-checked with the wife, obviously, nahi sir, जीना मुश्किल है ये आदमी के साथ. Right? I have to live because there's no other go. दो बच्चे कहाँ जाओ? रहना पड़ रहा है, सहना पड़ रहा है. कनाडा में कुरुली अंतिम, मुर्गा तरह, like an animal. Right? कठोर are the words they might use when they come to your clinic. So cruel people, immoral, right? Very violent. And beauty is this, that confusion. ये करो वो करो, ये करो वो करो, ये करो ये मत करो. This is that confusion you have in Anacardium. Okay. Hope you have got a clarity in Anacardium. Right? At least the take-home points, the must-know points in Anacardium. Mind and what I have just described today. Any quick questions? Anything you would like to ask? Repeat? Anything you want me to repeat? All fine, all clear? So if things are clear, let's not waste time. You can close.